Good morning, everyone. Today I will be talking about extractions in orthodontics. So, coming to the introduction, extraction is basically the painless removal of the teeth from its socket, and it is one of the most common methods of gaining space in the arch. So, especially in the cases of crowding, we require space. So, in order to that, one of the method to get space is extraction. So what is the need for extraction? So if a patient have any arch length tooth material discrepancy, we need to extract a certain tooth for the coordination of the arches and the tooth material. So ideally the arch length and tooth material should be in harmony with each other. So if the dentition is too large to fit in the dental arch without irregularity, it may be necessary to reduce the dentition size. So one of the most common method is the extraction of the tooth. So next need for extraction is for the correction of sagittal interarch relationship. So in an ideal class 1 case, the molar relation should be class 1 bilaterally. So if there is any other relations like class 2 or class 3, you have to extract certain teeth depending upon the molar relation and canine relation. So if in a class 1 occlusion, it is preferable to extract in both the arches because it is not advisable to discourage the development of only one arch more than the other. So in most class 2 cases with abnormal upper proclination, it is advisable to extract teeth only in the upper arch and to retract the maxillary incisors and canines. So in class 2 cases, with class 2 molar relation, usually we will extract upper fours, that is upper first premolars. In a class 3 cases, usually we will extract the lower first premolars to discourage the forward growth of the mandible. So in a class 1 molar relation case, we will usually extract upper and lower first premolars. So the next need is extraction for the relief of crowding. So first indication is the condition of the teeth. So you have to check the condition of the teeth, whether the teeth is fractured or hypoplastic, or if the teeth is grossly caries teeth or root canal treated teeth, and teeth with large restorations are preferred for extraction over healthy teeth. So in a case if you have the fractured tooth or any hypoplastic tooth or any grossly caries tooth, you have to extract those tooth rather than the healthy tooth. So next thing is the position of the crowding. Crowding in one part of the arch is more readily corrected if extractions are done in that part rather than a remote area of the arch. And the first premolar positioned in the center of each quadrant is usually near the area of crowding, whether in the anterior or buccal segment. So the most common tooth which is going for extraction will be your first premolars because of the its position. So position of the teeth in grossly malpositioned teeth which are difficult to align may often be the teeth of choice for extraction. So in certain cases you will see the position of teeth because if the tooth is severely malpositioned, so in the actual portion you can extract the malpositioned tooth instead of extracting the tooth which is in the arch. So that is also a need for extraction, or how to select such teeth. You have to see the case and you have to decide which tooth to extract or not. So coming to the different extraction procedures, so you have balancing extractions, compensating extractions, phased extractions, enforced extractions, Wilkinson's extractions, Tobey's extractions, serial extractions, and driftodontics. What are balancing extractions? Balancing extractions may be defined as a removal of a tooth on the opposite side of the same arch in order to preserve symmetry. So if you are extracting one tooth on the one side of the arch, you have to extract other tooth on the opposite side of the same arch. So you are basically balancing the symmetry of the arch by extracting one tooth on the opposite side of the same arch. So next one will be the compensating extraction. That is, in this procedure, extraction of teeth are carried out in opposing arches to maintain buccal occlusion. So in some class 1 crowding cases, it is necessary to extract in both the arches to maintain the lateral symmetry. So compensating extractions preserve inter-arch relationship by allowing the posterior teeth to drift forward together. So you are extracting tooth in the opposing arches. So if you are extracting 1/4, you have to extract 4/4. That is compensating extraction. So you have to extract to maintain the lateral symmetry of the arch. Next one will be the phased extraction. So it may be possible to effect a change in molar occlusion by extracting one arch only or a few months earlier than in the other. So you are planning extraction in a phased manner. So such extractions done in phases are called as phased extractions. The next one will be the enforced extractions. These extractions are carried out because they are necessary, as in the case of grossly decayed teeth, poor periodontal status, and fractured tooth or impacted tooth. So if such tooth are present in a patient's mouth, you will enforcing the tooth for the extraction. So that is known as the enforced extractions. So next one will be the Wilkinson's extraction. So Wilkinson advocated extraction of all first permanent molars between the age of 8.5 to 9 years. So if a patient is in the age of 8.5 to 9 years, uh, Wilkinson's extractions, they are extracting all four first permanent molars. So the basic idea is it is that the first molars are highly susceptible to caries. So at the age of 8.5 to 9 years, you are extracting the first permanent molars. So the other benefits of extracting first molars at early age to avoid third molar impactions by providing additional space for their eruption to reduce crowding in the arch. And Wilkinson's extraction are not usually carried out because of various drawbacks. Because first molar extractions offers limited space for crowding correction, and second bicuspid second molar rotate and may tip into the extraction space. So next one will be the Stobie's extractions. So extractions of two premolars at the same time is known as Stobie's extractions. The next concept is the serial extraction. So in serial extractions, you're basically extracting some deciduous tooth and some permanent tooth, especially the first premolar, in selected cases to overcome the crowding. So you're anticipating the crowding to be happen. Also after taking the OPG and with thorough clinical examination, you are extracting certain teeth to prevent the severity severity of the malocclusion. So you are basically extracting some teeth to to prevent to avoid the severe malocclusion to happen in the later stage. So what is driftodontics? This concept is applicable when extraction of the permanent teeth are done without appliance therapy, and teeth have a natural tendency to drift into the extraction space. So it is like you are extracting one particular tooth, and we are waiting, or the tooth itself will have a tendency to close the space by drifting into the mesial space. So that is driftodontics. So choice of teeth for extraction. So it will depends upon the direction and amount of jaw growth in the patient, and discrepancy between size of dental arches and basal arches, and state of soundness, position and eruption of teeth, and facial profile, degree of dentoalveolar prognathisium, age of patient, and state of dentition as a whole. So indications for extraction of different teeth. So these are the indications for the extraction of maxillary incisors. If it is mainly the maxillary incisors are extracted if incisors are unfavorably impacted. Otherwise, it is least common extracted tooth for the orthodontic purpose. So mandibular incisors are we will extract if it is a totally blocked buccally or lingually, or if it is severely traumatized, or if there is any severe arch length deficiency with fanning of the lower anteriors. In such cases, you can extract mandibular incisors. So next is when you can extract canines. If the canines are ectopically erupted or unfavorably impacted, or if your canine is totally blocked buccally or lingually, or deciduous canine extracted as part of seal extraction. In such cases, you can extract canines. So this is a picture showing some teeth which is completely outside the arch. So in such cases, you can extract such totally blocked out teeth instead of extracting the teeth in the arch. So first premolar, to relieve moderate to severe crowding and population, you can extract first premolar. That is the most common extracted teeth in the orthodontic purpose. And second premolar, if you want to relieve mild crowding and procrastination where anchorage loss is desirable, in such cases you can extract second premolar. Or it is in unfavorably impacted or in open bites. If you extract second premolar in open bite cases, there will be deepening of the bite. So such things can help in the treatment. So these are the cases where you can extract. So in these pictures you can see there is a bimaxillary proclination in C and E cases, and there is ectopically or buccally portion canines you can see, and in the second side, that is figure number 12, you can see completely blocked premolar. So you can extract such tooth. So extraction of first premolar, if it is mainly done if it is grossly carious, and second molar also you are extracting if in certain cases you can prevent the third molar impaction. So in such cases you can extract second molar. And third molars are usually not extracted for orthodontic treat purpose, may be extracted for other reasons such as caries, malformed or impacted tooth. So coming to the conclusion, extractions are done depending upon the choice of treatment by orthodontists, and they are done to give a perfect smile. So the extraction pattern will be you have to do certain clinical examinations. You have to see the X-rays before the decision of the extraction. And it is not like a cookbook approach, like you can extract a particular teeth only. You have to see the case, you have to study the case, and after seeing many diagnostic records, you can extract the desirable tooth. And the ideal thing is that you have to give it the perfect smile for your patient. Thank you.